Thank you, and good afternoon. Before we get to our informational charts, today the governor updated the public on the statewide progress on the 6 key areas that the state is using to guide and prepare for a potential easing in the future. Today in particular, they focused in depth on the issue of testing. In addition to our monitoring the metrics which have been previously shared that we need to see in order to unlock or move us forward into a potential easing, primarily those of rates of hospitalizations and percentage of positive tests. We know that as a region, we need to have the appropriate capacity around testing, tracing, and isolation. That is a core component, not just for San Diego and for California, but every jurisdiction as they look towards the future in terms of how they will prepare for that scenario. Last week, we announced a task force had been assembled to focus exclusively on this issue. This task force continues to work. We are coordinating with both state and federal officials on guidance, assistance, the possibility of coordination. Today we had a lengthy meeting and continue to work hard on preparing for that time in which we may be able to move into some changes in posture and some easing of the dials. In the coming days, we hope to share a more detailed announcement with specific goals and metrics, but right now I want to give you a quick update on the things and the general direction we're working on. We are focused on assessing the actual number of tests we need as a region every day in order to move to the next phase. There have been some numbers mentioned by both state and federal officials, some referenced in the media as a number out of every 100,000 residents. We're going to continue to work to firm up what we believe our San Diego daily capacity should be as a goal. And that would be a goal not just for capacity for tests, but all of the various pieces that go along with the test. The personnel, the PPE, the swabs, everything that makes a test become a reality to ensure that whatever that daily goal is one that we can achieve each and every single day. We also have to identify the proper protocols for who should be tested in what order to meet that daily capacity. There is some guidance out around state guidance, federal guidance. We need to assess what we believe would be most appropriate for us here in San Diego County. And given that testing is done through a variety of partners, clinics, commercial labs, hospitals, the county, ensuring that we are all on the same page will help us. Once we settle in on what is that daily goal and what are those protocols, then we will need to make an assumption of what percentage positive we think we will get. And this will guide our contact tracing. When we have an estimate of what percentage positive we think we get, we will estimate how many close contacts we think each one of those individuals will have, and that will shape how many individuals on staff trained to do contact tracing that we need, and that will guide our goal around there. When it comes to isolation, we're certainly ahead of the curve here with the large number of public health motel rooms that are available for individuals who cannot isolate on themselves. Again, we hope to release some specifics around this in the coming days, but know that we are working hard to ensure that this component of the next phase is ready to go at such time that the metrics and our public health experts determine it is time to take that next step. Now we will jump into our reports. Today we're reporting 9 additional deaths and 57 new positives. There you can see 57 new positives, taking us to a total of 2,491 cumulative to date. Number of testing today, we're reporting 1,514 tests, which takes us to over 36,000 cumulative tests that have been done throughout the San Diego County region. The next chart here represents a variety of things all outlaid in one. You see our positives along with the doubling rate of every 23 days, which is an encouraging number. The estimated number of recoveries, hospitalizations are up 19 from yesterday at a doubling rate of every 21 days. ICU beds are up 7 from yesterday, a doubling rate of every 28 days. And the loss of life is up 9 from yesterday, a doubling rate also of every 9 days. Slight uptick in motel rooms in both public health rooms of occupied and guest, along with the Regional Task Force on Homeless Rooms, increase in occupied and guest. Pretty significant jump in our personal protective equipment. You can see a pretty good jump in surgical face masks and gowns. I know that there's been considerable effort on the part of our staff here at the county to acquire those and make those available to our healthcare systems. We're now just shy of 2.3 million individual items of personal protective equipment that have been distributed. As usual, increase in 211 calls, nurse calls, epi calls. Hygiene kits distributed have now surpassed 4,000 individual hygiene kits that have been distributed primarily to unsheltered individuals. Hand washing stations remain the same, slight downtick in toilets distributed because they were at locations where permanent restrooms have been brought online. And our final chart on ventilators, just 20 out of 23 hospitals reporting when we ran today's report, 533 ventilators available. No change in the numbers that are being requested, serviced, and ready to deploy. I'll now turn it over to Dr. Eric McDonald for his report.